What's up guys, welcome back to my channel. My name is Callie Green, and in today's video we are going to be going into detail about being a dental assistant in the Air Force. If you're new here, welcome. My name is Callie Green. I am currently a dental assistant in the Air Force. Dental was actually number 6 on my list, but this job was the first one to leave for BMT, so I took it, and I've absolutely fallen in love with the career field. I'm currently trying to go to dental school through the Air Force. Subscribe to my channel, follow all my socials, so you can follow me on my path to dental school. To all my returning subscribers, thank you so much for clicking another video. I love you so much, and let's get straight into it. So in order to be a dental assistant in the Air Force, you have to score a 44 on your ASVAB. I hear a lot of people say that dental assisting or any medical job is really hard to get. In my personal experience, I left for BMT 3 weeks after I met my recruiters. So I did all of my ASVAB, MEPS, all that stuff like within 3 weeks when I was in BMT. My process was really fast. Dental assisting was number 6 on my list, and somehow it was the first one to leave for BMT, so I just got lucky. My experience so far is that we're kind of undermanned as a career field, and they do need dental assistants. So I don't think it's a job that's going to be super hard to get or that you're going to be waiting for a really long time, because the Air Force does need them. So your recruiter might tell you that you might be waiting for a little bit, and that might be true, but honestly, I think it's worth it. Unless you're in like such a rush to go to BMT like I was, I think it's worth it. I think you should wait for the job. But that's not just for dental assisting, that's for any medical job. Like, wait for the job. Being medical is so worth it, and being a dental assistant is so fun. In my opinion, I love it. So after you select dental assisting as your job, you're gonna go to BMT. That's 2 months long. I have an entire video on BMT if you wanna know more about that. I actually have a few videos on BMT that go into detail about that. And then after BMT, you're gonna go to tech school at Fort Sam Houston. Fort Sam Houston is located in San Antonio, Texas, about 30 minutes away from Lackland, where you do your basic training at. So tech school for dental assisting is only 2 months long. I know it sounds crazy. To become a certified dental assistant in the civilian world, you have to go to school for a year. But in the Air Force, you only have to go to tech school for 2 months. The reasoning for this is because dental assisting is mainly on-the-job training. You're gonna be in your upgrade training for a year after leaving tech school. In tech school, you learn the bare minimum about dental assisting. You start off by learning everything about teeth. You learn about the anatomy of teeth. You learn about head and neck anatomy, stuff like that. You learn about radiology, you learn how to take x-rays, and all the other basic things that you need to know about dental assisting before you get to your first base. Honestly, when I went to tech school, I would say it was a little bit outdated, because when I got to my first base, a lot of things we did were different than what we did in tech school. It was kind of outdated. I think they are updating the program right now, but really it's mainly on-the-job training, because there's so much to the career field to know that it would be way too overwhelming for tech school. So that's why you just learn everything on the job, and it kind of makes it easier when you're doing hands-on training. So after tech school, you can go to any Air Force base in the world. This can be a plus. You could go somewhere overseas, somewhere super cool, Germany, Europe, Japan, anywhere overseas you can go, but anywhere stateside you can go as well. So you could end up at a really small base with a really small clinic, or you could end up at a really huge base with a really huge clinic. Currently, I'm at a very small base, and we only do general dentistry here. So since you can go to any base in the world, if you go to a really big base, most likely those bases have specialties. So in dentistry, you have general dentistry, which is fillings, crowns, root canals, extractions, wisdom teeth, general stuff like that. You have ortho, which is braces and teeth aligning and stuff like that. You have perio, which deals with the gums. You have oral surgery, so actual oral surgeons. You have prosthodontists that deal with crowns and aesthetics and stuff like that. You have peds, so dentists that only work with kids. And then you have endo, which is only root canals. Keep that in mind that you could be assisting any one of those specialties. My friend right now is currently at Lackland, and she's assisting perio, so she literally just does perio all the time. So personally, I love the fact that my base is a general dentistry base, because I'm learning like the basics. So at my base, the things we do most are fillings. We do fillings so often, like it's the main thing we do at work. We do crowns every once in a while, which is so fun. I love crowns. We do root canals at my base, which I absolutely hate assisting root canals. That is my least favorite. We do extractions, which can be easy. Sometimes they can be hard. And we do wisdom teeth surgery at my base. So we do conscious sedations here, where we put people to sleep, but not all the way to sleep. If anyone at my base has a special case and they need something more than general dentistry, we send them and refer them off base. The only thing we don't send off base is ortho. If someone wants braces or Invisalign or something, they're gonna have to pay for that out of pocket. We do not refer people off base for that. So I have a couple day in the life vlogs at work if you wanna watch what I do day to day. I also have a week in the life vlog that shows what I do in an entire week. It was a very hectic week. I did kind of a little bit of everything, but I'm gonna be explaining what a typical day in the life looks like. So I get to work about 6:30 in the morning, and I set up my room. Every single day is different. Like I said, some days I do fillings, crowns, surgery, whatever I'm doing for the day, I set the room up for that. Some days I'll have like 7 fillings, so all day, back to back to back to back, I'll be doing fillings. Some days I'll have 2 crowns, 1 crown in the morning, 1 in the afternoon. Every day's different. It really kind of depends. Dental assisting can get a little bit stressful because a lot of times you run over. So like sometimes you're doing a filling and you think it's going to be a quick and easy filling, and then you get in there and the filling's a lot bigger than you expected. So the doctor's working way longer than you thought they would. So you run over. And also sometimes we have emergency patients. So sometimes patients come in and their tooth got infected, they got kicked in the mouth and they broke a tooth. Any number of things could happen where an emergency patient comes in and you have to do treatment that same day. So for example, one day I had fillings on my schedule all day, and then this patient came in and his tooth ended up being really, really badly infected, and we had to do an emergency root canal on the spot. So I ended up working through my lunch, going home really late that day. Like, my day was supposed to be a really relaxed and chill day, and then it took a complete turn and it was a really hectic day. But I learned very fast that every single day is going to be like that. Not every day is as it seems. Like some days are going to be chill, relaxed. You're going to have 2 crowns. Like it's a really easy day. And then other days it's like boom, 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 emergency patient, boom. It can be very hectic. It can be very chaotic, and it can be very stressful. So keep that in mind when you're picking this job. This job can be very stressful. Compared to other jobs in the Air Force, it's not that bad. I don't know. I have fun at work. I like my job. So I kind of like the chaos sometimes. I like the change. I like how you never know what to expect. Like every day is going to be something new. You're going to be learning something new every day. But yeah, on a normal day, I get to work at 6:30. I go to lunch at 11:30, and I usually leave about 3:45 to 4. If I'm running late, then I'll probably leave about 4:30. But I never have really crazy hours. I think the latest I've stayed is like 5:30. Also working in the dental clinic, we always have someone on call. So every once in a while, you're going to be on call. So every once in a while, someone will call the on-call dentist phone on like a weekend or after work and be like, hey, I'm having 10 out of 10 pain. I need the dentist right now. And if you're on call that week, you're going to have to get up and go to work. My supervisor the other day had to go to work at like 10 p.m. and do a root canal. But I've been here for over a year and I have not had to go in once for an emergency patient, knock on wood. I've had emergency patients during the workday, but never like on a weekend or anything when I've been on call. So I have got very lucky. So my base is very undermanned, and when I first got here, we did not have a lab tech. For an entire year, we didn't have a lab tech, so we had to do all of our own lab work. We had to pour up our own models, we had to make our own retainers, we had to send out cases to the dental lab. So dental lab is a completely different job in the Air Force. Dental assisting is completely separate from dental lab, but keep that in mind. If you get to a small base that's undermanned, you might have to do your own lab work sometimes. I hated the lab at first, but now I think it's fun, and I want to be a dentist, and lab work is such a huge part of dental school. So I'm very glad that I got like the hands-on experience and I learned like everything about the lab. So I think it worked out for me, but just keep that in mind. You might be doing more than dental assisting sometimes. So with this job, you're not always going to be in patient care. You could be in SIPSI, which is where you clean and sterilize the instruments, or you could be working the front desk, which is where you like check patients in, schedule patients, you deal with the records, you deal with all the dental admin stuff. Dental is the only medical job in the Air Force that does their own admin. You can be medical admin in the Air Force, but you don't do anything dental related. Dental does their own admin work. Patient care is cool, but honestly, I love SIPSI. Every base calls it something different. SIPSI, DIPSI, IPSI, basically the Instrument Processing Center. Personally, I love it. It's so relaxed at my base. Like, it's very chill. I feel like when I'm in there, it's like I breath of fresh air. I don't have to deal with patients. I can listen to music all day. Like, I love SIPSI. Front desk can be very hectic. I kind of hate the front desk, but I like it every once in a while because I like to be social. Like, I like being at the front desk and talking to everybody that comes in. Like, I like that aspect of it, but I hate when it gets like very busy and it's just a lot of admin work. I kind of like being hands-on in patient care more than being at the front desk. All right, next I'm going to be talking about career progression. So after you've been in for a couple years, you're going to go to school to be a prophy tech. A prophy tech is someone that cleans teeth. So it's not a hygienist, it's one step under hygienist. You just do basic prophies all day. So when you become a prophy tech, you're gonna be doing the annual exams and cleanings all day. Like, that's literally your job. So it's a lot less stressful than the operative side of patient care. Like, all day you're just doing exams and cleanings. You kind of get to build your own schedule. You have your own DTR, you can customize it. So it's a lot less stressful than being in patient care. You're not like running around all day. Every day is not different. You're not like having to come to work like 45 minutes early. You're not leaving 45 minutes late. Like, you're just doing cleanings and exams and talking to your patient, stuff like that. The only times I ever see the prophy tech stressed out is when the doctor takes really long to come and do the exam and then they're running late. But other than that, like, you're not really going to be running late. Like, you're just going to be doing your cleanings and listening to music and doing exams. I don't know if y'all can tell, but I'm very excited to be a prophy tech. I'm very excited to live that peaceful life. I love patient care, but I'm a little burnt out, I'm not gonna lie. So if anyone out there wants to be a dentist or hygienist, they know that they want a future in dentistry, or if you join this career field and you end up falling in love with it, there's a lot of things you can do to progress in the career field. So the Air Force actually has a hygiene program. You can go to hygiene school through the Air Force, and they'll send you to a school in Florida for 2 years where you're gonna become a hygienist, and then you'll be a hygienist in the Air Force. This is really amazing because you get your entire hygiene school paid for, and it's gonna transfer to civilian side because hygienists make really good money in the real world. If you want to be a dentist like me, they have a scholarship program where you can go to dental school through the Air Force. It's called the Health Professions Scholarship Program, and you can go to medical school or dental school through the Air Force and they will pay for it. You can go to any dental school of your choosing and they will pay for all of your tuition and fees, and they'll pay you the entire time that you're there. Not only will they pay for your dental school, they'll also send you to a residency, which is 1 year long, and then all you have to do is pay 4 years back to the Air Force. And then after that, you can stay in the Air Force and retire, or you can get out of the Air Force after you pay your 4 years back and be debt free. Dental school after 4 years, tuition, supplies, cost of living, everything, like $500,000. So doing it through the Air Force is very much worth it. But if you don't want to be a hygienist or a dentist, you can stay a dental assistant your entire career. When you become an NCO, you can be in charge of different programs in clinics. So you can be in charge of records and admin stuff. You can be in charge of infection control. You could become a flight chief, so you could run an entire flight. Not everyone in this career field goes to hygiene school or dental school. You could stay in this career field the entire time, don't have to go to any extra schooling, and you would be good. The last thing I'm going to talk about is the regulations of this career field. I didn't really think this through, but you know, the Air Force has regulations for your nails, your hair, all that, but dental has a completely different set of regulations. So when you're in this job, you're not going to be able to have your nails done. You're not going to be able to have long nails. You can't have these nails in the Air Force anyway. I'm just on leave right now. But you're not going to be able to have nails at all that extend past your fingertips. We're only allowed to wear natural nail polish, no gel, no acrylics, nothing. Some bases are more lax about it, and then other bases like mine are like, if I see you wearing anything other than natural nail polish, you're getting paperwork. So just keep that in mind if you're a girly who loves having her nails done. Not in this career field. You can wear up to 3 rings in the Air Force. Not when you're in patient care. You can wear jewelry in the Air Force. Not when you're in patient care. Keep that in mind when you join this career field. Your regulations are going to be completely different than Air Force regulations. But the plus to that is you don't have to wear a uniform all the time. Honestly, wearing the uniform can get very, very uncomfortable. Wearing it every day, I hate it sometimes. But day to day in patient care, you wear scrubs all day and you wear clinical shoes all day. So you can literally wear scrubs and Crocs. It's like wearing PJs and Crocs all day. I can't have my nails done, but I can wear scrubs and Crocs all day. So I'm like, a win is a win. Thank you guys so much for watching. If you have any more questions about being a dental assistant in the Air Force, or there's something else that you want to know about the career field that I didn't get into today, or you have a question about something I talked about today, please comment it. Don't be afraid to comment your questions, ask all the questions. I couldn't really find a YouTuber that talked about dental assisting before I joined. So I am your YouTuber right now that's here to answer all your questions before you join. If you're in tech school right now, I'm here to answer all your questions. I want to make sure you know what this career field is and you have all your questions answered before you pick the job or before you get to your first base. I love you all so much. If you haven't yet, hit that subscribe button. I am trying to get to 10K by the end of this year. We're this close, y'all. We are so close. Please hit the subscribe button. I post all things Air Force, dental, and I post other things too. And honestly, my channel is just a vibe. So join the family. I love you all so much, and I'll see you in the next one.